Welcome everyone, and thank you for joining ACCE today for a 1-hour Partner Solutions webinar with our strategic partner, Project N95, focused on COVID-19 impact and insights, what business owners need to know. My name is Lindsay Slater. I'm the Director of Communications and Storytelling here at ACCE. Moderating our panel discussion today, Eli Velasquez, representing Project N95, an NIH-funded nonprofit organization working with chambers across the country to make sure that their business communities have COVID testing resources and PPE needed to reopen and recover, keeping everyone healthy. I want to thank Project N95 for working with ACCE as a strategic partner in this endeavor. We appreciate their support and understand how important this issue of public safety is to the economic recovery of our country. We are pleased to partner with your organization. Today, we'll hear from a panel of healthcare CEOs who will share the latest industry insights and best practices for promoting a safe work environment for employers, employees, and the general public. Before I introduce Eli, I want to cover a few housekeeping items, as well as get a quick set of poll questions launched to get a sense of where we are as an audience in regards to today's topic. So we'll see if we can get our poll questions going here while we do this. There they are. So if you could just open this and we'll see the results here. So attendees, you are on listen only mode to avoid background noise. If you have questions, please utilize the chat feature as we listen to the panel. We're leaving about 15 minutes for Q&A, so don't worry, there will be time for everyone's questions. Feel free to use the chat for comments or feedback about today's program. And finally, today's session will be recorded and emailed to you in about 24 to 36 hours. So please feel free to share with your colleagues and your business community. It will also be posted to our ACCE site under the Programs tab. Just click on Online Learning. Well, let's head it over with today's panel moderator, Eli Velasquez, representing Project N95. Eli.
Thank you, Lindsay, and welcome everybody. As Lindsay mentioned, please place your questions in the chat. We want to make this as informative as possible. Before I introduce our esteemed panelists, I want to introduce myself. My name is Eli Velasquez. I'm a representative for Project N95 via the NIH RADX initiative. NIH, about a year and a half ago, allocated $1.5 billion to, get COVID diagnostic tests out into the market. And through that, a series of channel partners and providers like our panelists and, that are on this call, we were able to make relationships with in order to get some of these tests out into the marketplaces and industries that were needed. And so through this conversation, we want to outline kind of some of the trends that we're seeing, some of the gaps that still exist, and for you and your constituents and your members, what's going to be important for them to know and understand, and where are some of the resources that they need to get to. So again, Project N95 has partnered with the ACCE to be a resource provider for a lot of information for COVID tests, for PPE. So at any time, feel free to hop on to projectn95.org for more information. As I get started, I'm also seeing the poll results. So many of you are fully open for business, which aligns with what we're hearing a lot in our channels and in the media. Many of you, about 60% of you has been fully vaccinated, of the constituents you serve, and a majority of you are no longer testing 60%. Again, this aligns very well with what we're also seeing in the marketplace. So I don't think any big surprises there. But again, we want to highlight some of the trends and kind of nuances that we're still seeing in the industry. So with that, let me go ahead and introduce our esteemed panelists. First and foremost, there's Andrew Kobalinski. He is the CEO and co-founder of Primary.Health. Dr. Patrice Harris, she's the CEO and co-founder of eMed, and also the past president of the American Medical Association. And Dr. Cheryl Lee Eberding, the CEO and co-founder of Azova Health. So esteemed panelists, thank you so much for joining us. I want to go ahead and start with some brief introductions by each of you, introduce a little bit about your background, and tell us a little bit about your company before we dive into the content of the discussion. So Andrew, I'll start with you.
Thank you, Eli. Hi, Andrew Kobalinski, CEO of Primary.Health, co-founder as well. Our team was born in COVID. We were a volunteer group initially early in the pandemic when communities wanted to bring testing and make it available to the general population and try to actually understand how the disease was spreading in our populations. So we got our start in San Francisco, California, doing a study with UCSF in the Mission District and a community in Bolinas, California. We learned early in the pandemic that we're missing all the puzzle pieces and trying to actually fight this and understand what's going on in our communities. So our company was founded to just work with local public health, work with researchers, different tools, and help us have an ability to actually reopen our economy safely and manage our workplaces and take active control of this disease versus just reporting on it. So I'll speak a little bit later about how we do that. But thank you, Eli.
All right, thank you, Andrew. Dr. Harris?
Yes, well, good morning, everyone. I am Dr. Patrice Harris. I am a child and adolescent psychiatrist by training. And as Eli noted, I am a past president of the American Medical Association, having the privilege, though, to serve and be president of the AMA at the beginning of this COVID-19 pandemic. I'm here today also as CEO and co-founder of eMed. We are a digital point of care company. And at eMed, we started with the vision of problem solving. There's a lot of talk about innovation and technology and the marriage and connectedness to healthcare. But unfortunately, what I've seen is a lot of bright, shiny objects, sort of innovation in search of a problem. And at eMed, we believe just the opposite. We believe in problem solving. And so originally, pre-COVID, we were thinking about the future and the future of innovation in healthcare, but we quickly pivoted when we saw the huge access problems with testing. And I think we are not the only ones who saw that, right? There were long lines. You most of the time had to have a car to drive somewhere to some point of care. When you got there, you perhaps had to wait hours, and then you had to wait days for your results. And certainly those testing locations were not equitably available to everyone. So we saw that as our primary problem to solve, and we set about solving that problem and asked the question, what if? What if we could bring evidence-based, science-based quality testing to the home? That would be so much more convenient for everyone. It would certainly increase access. Cost was another factor. I think many of us saw the high cost of some of the original tests, and so we wanted to make our tests affordable. But we did not want to lose any quality. We wanted to make sure that we could stand with, and that our platform plus our tests would stand up to the science. That is a problem that we wanted to solve. We partnered with Abbott so that we could offer the digital platform for the Abbott Binax Now test. Folks can take that test in the convenience and the safety of their home, thereby not going out, by the way, and risk exposure to others if they were infected, or risk exposure to themselves by just being out amongst all the folks that were getting tested. So there was also the health issues there. And so again, we developed that so folks can take our test at home and get the results within 15 minutes. And one of our certified virtually guided proctors, by the way, real time walks the, and I will say patient a lot, I'm a physician, I'm sorry, I can't get out of that habit, but walks the person to the test, through the test, from opening the box to the end. Thereby, our proctors can see and verify, yes, that's Eli taking the test. Eli signed up for this test, he purchased the test. Yes, that is Eli taking the test. And we walk Eli through the test. We want to make sure he's taking the test and he hasn't swabbed his dog's nose. And through the very end, make sure that Eli performed the test correctly. And once Eli took the test, again, results in 15 minutes. And we were able to then have Eli show the test results to our proctors and end that. So we believe that we did solve the problems of access, affordability with quality. And so now we look to the future and what else we can do with those same values in mind.
Thank you so much. And Dr. Eberty? You're on mute.
Sorry. Can you hear me now?
Yes.
Sorry about that. My name is Shirley Eberting. I am the CEO and founder of Azova. I am a physician, a dermatologist. I am also an NIH trained clinical research scientist, and also a mother, technologist, and entrepreneur. And really excited to talk to you today about what we do as well. Azova is a globally connected digital health system. Our technology platform is about 7.5 years old. It is not something that we just spun up during the pandemic. It already existed. We were already doing lab testing, already doing telemedicine, already doing pharmacy clinical services. In essence, we are a digital health benefits platform providing healthcare benefits and healthcare services to self-insured employers. With COVID, we quickly launched many different COVID testing programs and services. We manage COVID testing for governments, for health departments, for universities, for schools, for small and very large self-insured employers. We also have developed a very robust and connected distribution system to enable the management of COVID testing on a community level, a statewide level, a national level, and an international level. We launched in the fall with Costco Wholesale Corporation. We manage all the COVID testing that goes through Costco. We are also a Hawaii trusted testing partner, a Bermuda trusted testing partner, a Barbados trusted testing partner. We launched and now manage the domestic and international COVID testing for Alaska Airlines, Delta Airlines, Virgin Atlantic, and several more airlines as well coming online. Within the last week, we also launched an at-home COVID testing partnership with many of the manufacturers of the at-home antigen and molecular tests to provide video observation for the antigen tests, in addition to the tests that we were already providing this service for. So now pretty much almost any test that you need video observation services for, you can receive that service through Azova. Azova's really, sweet spot is our ability to customize a solution for any organization, depending on your desired workflows, the location of your employees, and the turnaround times, and many different variables we can take into account to enable your population to get the testing services that we need. In addition, Azova also has a very robust vaccination management platform called Vaxigo. Vaxigo is also 7.5 years old. We filed patents over 5 years ago for an international and globally shareable vaccination passport or vaccination record. And that also has come to fore, of course. That tool is used globally now for proof of vaccination. And we also provide a vaccination verification service for employers in the United States, a way for employees to consent to share their vaccination status in a very non-obtrusive way. And so those are some of the things that we do, and very happy to be with you all today.
Thank you, Shirley. So I want to get to the heart of the poll results, because this is the question we get asked all the time. And we hear this from different employers and different industry folks. Eli, I'm opening fully. I got to get my employees back to work. Most of them are going to be vaccinated. Testing is expensive. What's the case for testing, in your opinion? And I want to start in reverse order. Shirley, I'll start with you. Why is this still important to date if we have vaccines already on the market?
Well, I think first of all, there are a couple of questions that you asked. So first of all, what is your vaccination rate in your area? Second of all, no one can ignore the Delta and Gamma variants coming onto the scene. So they are very real and they're very dangerous. And we don't really know yet what protection immunization offers, if any. They are definitely more contagious and they definitely are more deadly. And so I think testing your population on a regular basis is very important. And there are now affordable solutions to that. including pooled surveillance testing, where you can test a very large population very, very easily, very non-intrusively, at a very low cost. And then, being able to reflex your pooled testing to a diagnostic testing is really kind of the gold standard. But anyway, so you really want to pay attention to this, and I think it's important not to abandon the testing of your population right now.
Dr. Harris, I'll turn that same question to you.
I agree with Cheryl. We have always thought about mitigation in terms of layers. It's never been, since the beginning of this pandemic, just one thing, right? It's always been testing, mask wearing, washing your hands. And so we need to continue to think about providing as many layers of protection as possible. So I always say vaccines, yes, and testing, yes. They are not mutually exclusive, as well as other mitigation measures. I also agree with Cheryl that we are seeing these variants and they are a cause for concern. And though we might look at the numbers and see broadly and overall a decent level of vaccination in our country, there are pockets, different pockets, regions, localities where there are a lot of folks who are unvaccinated for various reasons. And then we certainly have our children, and we have seen in the last month or so, hospitalizations rise. And these hospitalizations are younger folks, because we do have a higher percentage of our 65 and older who are vaccinated. And we also see inevitably that all of these are unvaccinated. So we still need testing as mitigation. And let's say we didn't have the variants, which we do, and they are a cause for concern. Pretty soon, we will be entering the flu season, the cold and flu season. And so we will have sniffles. And the question will be, do I have a cold, or do I have the flu, or do I have COVID? And it will be important to get the answers to those questions, because those are actionable. People can do something about them, and then we can risk further outbreaks and further illness on an individual level. And I think businesses want to know, because you want to keep your employees safe. You don't want your employees coming to work at risk of exposing others. And so for those reasons, we still need to continue to test.
Excellent, thank you. Andrew, same question.
Yes, so we've been working with many school districts in California and about 280 additional organizations. So with our program with the California Department of Public Health, we've been rolling out the Abbott, and what we're seeing kind of across the country right now is that we're seeing Delta variant is starting to spike in places you wouldn't expect it, in communities that have technically herd immunity amongst the overall population, but there's a little pocket, 20 kids, 20 employees in one group are getting infected, and infection is not bubbling up to a county level, but it's getting everyone in that workplace. So if there was someone who was unvaccinated and vulnerable, if there is someone who's immunocompromised, if there are visitors coming to your work site, it's effectively the Delta variant is cropping up and grabbing everyone in that bubble. And what that's going to create into the fall are just very unsafe small pockets of disease and outbreak, and a lot of very sad stories that will not necessarily cause a blip in kind of another wave in our national charts, but they'll be local. They'll be in our communities, our families, our friends. I've lost family members to COVID. And that will continue into the fall and before Thanksgiving and the Christmas holiday. So the testing programs, as we go forward, now that we actually have real tools that can be purchased at CVS for a low cost, and as EMED and Patricia, there's a lot of options finally to actually stop transmission, to detect these bubbles before they become outbreaks and get to the vulnerable members of our community. So as we look forward to the fall and these Delta variant outbreaks happen and they get into rural communities that maybe have low community spread, so low levels of naturally acquired immunity and low levels of vaccination, or migrant, transient workforces, individuals that might be coming from other countries with not an mRNA vaccine, there's populations that we just need to protect. That's the reality. And as
Thank you.
business leaders, we're aware of that, and the tools are so inexpensive and convenient. I have at a manufacturing plant in Colorado, in aerospace. They're testing twice a week, and employees and HR managers are literally hands off. Our clinical team calls the positives and then calls the HR manager saying, hey, you had 2 cases this morning. You can plan shifts around isolation of those individuals and keep going with your day. So what was once very difficult and burdensome to operationalize a testing program, that has changed. We have completely different tools in the marketplace, and we can actually do this fall.
Excellent. Andrew, I think I know which facility you're referring to. I used to travel there quite frequently in my early engineering days. So Dr. Harris, I want to turn this question to you, and Andrew, I love the example you shared. I'd love to hear specific use cases, because our participants on the call, they represent, constituents large and small, the Main Street businesses to large scale manufacturers and operators, so I'd love to hear of maybe a couple of use cases that you have personally helped through your company get going with their testing protocols.
So let me talk a little bit about our relationship with governments. As we know, firefighters, EMT workers, there were some workers who did not have the privilege of staying home. I'm sure there are folks on the call who have employees that could not stay at home, right? We relied, my fiance has a trucking business, and we certainly needed those in the trucking industry to stay on the road so we could do as much as we could to keep the supply chain going. So once we were beginning to open up, we had the opportunity to work with governments to make sure that their firefighters and, again, first responders had the opportunity to get our tests, take our tests home with them, and they were proactive, and they could proactively test, again, to make sure that they tested negative before they came to work. And of course, that was a part of a serial testing strategy. And this is the other thing, we hadn't talked about this today, but right, there's no one size fits all here. And so each business could decide what they want to do. You can use these tests strictly on a diagnostic level. You want a one-time answer, and that's a possibility. But a lot of folks have been using these tests for what we call screening and surveillance. It's that ongoing, regular cadence of testing. And when you do this with antigen testing, and you do this in a regular cadence, that of course certainly increases your pickup on some of these issues. So we had some partnerships there. We partnered with the business, and this is an art business, who wanted to make sure that the workers who were still coming to work tested negative. And so they also use these for screening and surveillance. The restaurant industry, right, folks, and again, and this was, I think, important, and is always important for us to know, this COVID-19 pandemic, of course, stating the obvious, has evolved. And so the testing needs last May are not the same testing needs today. And we all need to be able to quickly adapt to new testing ideas and new testing regimens. And so that is a key feature of what we can do at EMAD. Again, we keep our finger on the pulse of what's going on, and we can quickly adapt there. Most recently, excuse me, you may have seen our project with the airlines. We know that the CDC requires a negative test upon re-entry from an international trip. So we've partnered with a couple of airlines, and folks purchase our tests, and we say they pack their toothbrush, pack their COVID tests, take them with them on the trip, and then 72 hours or so before returning, they can take our test, again, go through the process and have that negative test and ease that stress of coming back to the country. So those are just a few of the use cases that we've been involved in.
Those are great. Cheryl Lee.
Yeah, so several different things. It really depends on the client. So if you are a health department, for example, we have implemented essentially a network of COVID testing locations. through our technology stack. So we can essentially combine or link together your pharmacies, your hospitals, your physicians' offices, your drive-through locations into a single interface to enable consumers to find their nearest COVID test. So that's one use case for health departments. And then also athletic testing for schools. So athletic testing, each state has, some of them have their own different requirements as to who has to be tested and when they're tested and at what frequency. But testing athletes, it's usually the day before. They have to have results within 24 hours before they play. Providing services for athletes, nursing homes, and congregate settings. So each of these is a unique workflow. There's a lot to be considered in the workflow. Is the ordering, and does a test itself require a prescription or not? Does a test have to be observed or not, based upon the emergency use authorization of that particular test? But in nursing homes and congregate settings, enabling the local staff to provide the testing to their own residents and to receive the results from their own residents. Universities, so mass testing for universities, testing thousands, in some cases tens of thousands of people in a single day, and creating really, really fast throughput workflows for these scenarios. For the employer, probably the most common scenario is what we call on-site individual use kit testing. Azova has several different emergency use authorizations and kits that we work with, depending on the client. But in this scenario, if a PCR is requested that has the highest sensitivity for a diagnostic test, the employer is able to pre-purchase the kits, and the employees can come and take them anytime they need to take them, drop them in the next day air UPS, and get their results within 24 hours. Each of those is a unique use case and a unique scenario. And then more recently is pooled testing, so pooled surveillance testing. And pooled testing, there are several different types of pooled testing. Both nasal swab or saliva testing can be done in a pool. And then it is dependent upon the test, how large your pool size can be. The larger your pool is, the less sensitive it will be. However, pooled testing is a very rapid and low-cost way to test a very large population. But if you're doing pooled testing, you want to be able to do it in a way that enables you to do a reflex diagnostic test after the pooled test. And so each of those are unique workflows that you need to work through or think through for your population. And so again, as Dr. Harris said, there's no one size fits all. It really is dependent on what the particular organization needs, how big their population is, how geographically dispersed their population is, to find the most cost-effective and effective solution for them.
Thank you, Shirley. So this is also a common question that we get is, okay, so where do I begin? How do I even begin to start thinking about this? Because we do, you start thinking about your workflow, your workforce population, there's speed, there's accuracy, there's cost. So Andrew, I would turn this over to you. Is for the employers out there, what are the 2 or 3 things that they need to start having the conversation about when they're thinking about testing and getting back to work?
Yeah, I think there's fundamentally two decisions to make. Number one is, how often do you want to do testing of your employee populations? What reasons? Just sites? Do you have immunocompromised? You need to make a decision about what kind of testing you want on your work site. And then number two, how are you going to operationalize it? Are you going to make it a voluntary program that your employees do this on their own? It's minimal disruption. It's almost invisible. It's as convenient as swiping your key card on a entry door. Or are you going to actually pay and staff a site or do observed collections or something more involved that's maybe a little bit more prescriptive and you know definitively if someone has done it or not. So you need to make those two decisions. Once you make those two decisions, there's a whole host of options out there. I love the work that Project N95 is doing to bring new testing modalities kind of into a marketplace where it's really easy for employers to purchase in bulk test kits. Think back to last fall, how amazing that would have been for so many different industries, where the only option was to hire a nursing team to come on site and do supervised swab collections. And the cost was just prohibitive, hundreds of dollars per specimen. Now today you can do these things at fractions of that. So once you make those two decisions, then just getting online quickly, getting up and running with something that's very simple. In primary health use case, we can onboard different employers the same day, and it takes about 20-30 seconds to complete the registration and result your first test, like one of these cards. Super simple. If you're doing an observed collection with a tube scan of a common PCR kit, that's also very quick. So don't be afraid. There will be hesitancy amongst HR managers about, do they want to be involved with the testing? Do they actually want to manage it themselves, or do they want someone else to manage it? I like to say, push your team a little bit over. Once they go through training and they try it once, they'll say, this is really easy. It's a lot easier to run these programs today than ever before. And they're great options that can be done at home, in the work site, in the car before getting to the office. So a hybrid approach, multimodal, is definitely the way to go, but also don't stress about it. Just choose something and try it. And if you don't like it, iterate.
That's good advice, Andrew. Appreciate that. Dr. Harris, the other thing that we hear a lot about from employers is liability, and what the implications of that might be in the workplace. What are you seeing in the industry around how employers are tackling liability issues?
Well, first of all, it's an important question to ask. And certainly I would start with a company's own attorneys. And I would say, as you are discussing this with HR and your general counsel and other relevant staff, that is a question you should ask. And it would be based on what you choose. And I like what Andrew just said, though, don't be afraid. Just start and get the answers to the question. If I choose option A, and get 3 options. If I choose option A, what are my liability? What are the risks if I choose option B? And so I think if you think about that proactively, then it's not a worry going forward. But I think it's always a fair question that should be asked at the beginning of the process. And then you can have some level of comfort. So yes, that is a question that everyone asks. And again, as all of us have said, it will be different based on the company, based on where their employees, and then based on what you do. But it is a question that we always answer. So we go through use cases, we share other businesses and what other governments have used and how they have solved the problem. And then ultimately it is up to the particular business to make the decision. But I think it's a good question to ask at the beginning of the process. And that should be one of those matrix boxes that you check and make sure you are comfortable as a business with whatever level of liability might be there.
Excellent. So I'm going to open this question up to any panelist that wants to answer it. And the question is this: do any of you have an example of a use case where one or the other, they started testing, then their employees started getting vaccinated, so they stopped testing, but now they've started testing again? And what was kind of that methodology that they went through? Or 2, they weren't testing, but now they're going to start testing because of whatever reason. Do any of you have any specific use cases like that?
Yeah, we certainly, sorry, Andrew, we certainly do, especially as businesses are opening up. And, we've got several businesses that are, they're in a highly immunized area. And really, first of all, contemplating their strategy of, okay, should we be testing our immunized people and our non-immunized people? Should we require immunization for our employees to come back to work? Okay, if we require employees to be immunized, well, how do we get their records from them? Because we really have no business in doing that, frankly, right? And so these are the thought processes that they are going through. And so we have really helped them to find a way, a non-obtrusive way to obtain consent to just view the status of their vaccination. You're not sending your records or your personally identifiable information. It's a yes or it's a no, right? And then also we are advising them to continue to do testing, especially with the variants that are coming on the scene. So I think, these organizations that are starting to open up, we have many of them that are really just barely starting to bring their employees back on site, that are going through this process right now, trying to figure out how to manage it.
Yeah, and I'll add to what Cheryl's saying there, and saying that we know our populations. So you as leaders kind of understand how vaccinated your population is. And many of our employers have actually sponsored vaccine clinics in the workplace to assist and make it really convenient for those that might have transportation or access issues to local vaccine providers. And so that's really brought the vaccine rate up. But now that we are reopening, we're starting to take visitors into our offices. We're starting to host events. And these environments suddenly are unknowns. You can't apply an HR strategy. You can't require or ask of this visitor population their vaccinated status. So what we're seeing is that testing is coming back as kind of a courtesy of a protection on those group gatherings or visitor gatherings, to bring some comfort and a safe kind of reopening of the social aspect of work, where you may know a lot about your own population, but you need to interact with other populations. And so it's a really good tool for that.
Excellent.
I will just quickly add, I mean, we've seen both of your examples and more, right? Because, you had some folks who've been 100% virtual until maybe the last month or so. And you have had some companies who have been all or 100% in person since the beginning. And so through the ebb and flow and the evolution of the pandemic, you've seen different opportunities for testing, and there has been some ebb and some flow. But I can tell you just over the last month or so, and I think it has to do with a lot of things. It has to do with more people are in that what I call return to phase. Based on the poll at the beginning of this meeting, we had a lot of folks that had already returned to work, but we know people are in different phases of that. And some people are just now beginning to think about returning to work, actually, which is pretty anxiety provoking. And so now they want to make sure that they have a good testing strategy in place. So I think we've seen both and all of the above. And really it's important. And a point I was going to make is data is critical on this because data then allows you to iterate and change, based on what you are seeing, based on the needs of your employees, based on any outbreaks, based on the level of vaccine in your community. So we monitor in real time what's happening with all of our clients. And then we are able to, again, adjust with them because through our platform, we're able to do that and just continue to evolve and learn and make adjustments as a business's needs change.
Yeah, absolutely. So I want to start opening the chat for the audience to ask questions. I'm going to keep asking questions, but if you have a question, feel free to put it in the chat. As some of the components of the workflow that we talked about was, what point do we engage them? Is this an at-home thing? Is this an on-site thing? Who are the individuals within my organization that have to do this? So we're talking about this from the people level. And Dr. Harris, I want you to touch on this, and I want to hear from the others as well. What about the technology side of it, right? What data should we be capturing? What are the solutions that are out there? Should we outsource this? Should we develop something on our own? Like what should employers be thinking about when it comes to the technology component of testing and back to work?
The first thing I will say is, and this is something I say, I've had the privilege of giving several commencement speeches over the last 18 months or so. And I always say, if someone presents an either or argument to you, run. Because again, it's rarely ever either or, it's probably both and it will depend. And certainly we've thought through that at EMED. We have never said and would never say that this is the only solution, right? We have always talked about being a tool in the toolbox because we think we need that flexibility. Employers, leaders, CEOs need that flexibility. You know your business best. You know your business needs best. And so that's where the technology can come into play. For us, we have the data. Of course, there are certain data information that we are required to collect. Imagine that's everyone on this panel that the CDC has required that we collect this information. And so we have that information, by the way, which also reminds me that we should always keep data privacy and data confidentiality in mind. And that's something you have to think through again at the beginning and make sure you are holding true to those values of privacy and confidentiality and data sharing. We have a reporting capability, of course, that it was required to report that to local and public health officials and federal health officials. And so that's where the data comes into mind. Now, there are some businesses that may want more. And of course, again, with their employees' consent and based on their own rules and policies and procedures, they can get that. But on our side for EMED, we own the technology piece. And so that is our piece of the problem. And we say, here's the problem, here's the solution to the problem that you have. You have enough, let us solve with you and for you the technology problem.
I like that. Cheryl Lee.
Yeah, I would agree. It's definitely not a should we do it at home or should we do it on site? It's yes. The answer is yes, because you're going to have scenarios and employees who need both options. And as far as the question of the technology stack as well, COVID testing is probably one of the most complex things I've ever done personally. I have employees in 5 countries across the world now, and complying with all of the government regulations, the emergency use authorization regulations, the local regulations, all of those have to be taken into consideration. And so each of us here on the panel, we're really experts in this. This is kind of what we eat, drink, sleep, and breathe. And there are nuances that you really would have no clue that you even needed to be considering. And that's what we're here to help you with and to protect you from, treading into waters that you could fall out of compliance. So that's really kind of where we excel and really help you to roll out a program. Unfortunately, we can't say, okay, Eli, you asked us, okay, what are the first steps? Well, we can't even answer that question because who are you? How many employees do you have? What states are your employees in? Are your employees traveling nationally, domestically? Are they employing internationally? Are they traveling internationally? Do you want to have PCR diagnostic testing with the highest sensitivity and specificity? Or are you okay doing serial testing with a lower sensitivity test, but an aggregate, equally sensitive test if you do serial testing? Do you want to do pooled testing? Do you even have the setup and the workflow to support pooled testing? Because that's the cheapest, right? So there's really kind of a triage that we will take you through and really consult with you to find the best solution for you to get your employees back to work.
That's always encouraging to hear, Shirley, because a year ago, it was just wild west, right? And there was just so much confusion in the market, and I love hearing the conversation now, fast forward, where you can say, here's how we approach this now, here's how we're more thoughtful about it, and how quickly we were able to mobilize solution sets. Andrew, I'd love to hear your perspectives on the technology stack as well.
Yeah, so it's interesting. So primary.health became in existence because the tech stack wasn't set up to deal with mass testing and mass community vaccine. Like, we had to build platforms to enable this at this scale and with the kind of efficiencies and social equity and meeting our members, our employees, our participants where they are. And it's through months of work on technology platforms like primary.health that California's Department of Public Health has basically, they make our platform available with free kits from the state stockpile to anyone in agriculture, manufacturing. You can apply today and you can get access to our software and test for free in California, as an example. And I know Dr. Harris in Colorado has similar types of programs. So definitely don't build it yourself. Just kind of ask around a little bit, and there's free programs, free tests right now where local public health is, I mean, they're data nerds. They're looking at where are the hotspots, where are the problems, and they really want to solve it. They have the funding, the resources, the kits to kind of contain this outbreak into the fall. So yeah, just work with us in California, for example, or other markets, and we can get your organization set up. There's already an existing infrastructure to leverage that.
Excellent. So there's a couple questions in the chat. You know, how long will the vaccine protection last? How will that timeline impact testing in the fall, the winter, and even beyond? I will highlight that my wife's company is developing a vaccine for the UK. They're going through booster trials because there's, you know, studies around what type of booster, will we need a booster? And again, how does that impact, you know, testing? So Dr. Harris, I'll start with you.
We don't know the answer to that question, to be honest, but of course we've had folks who have been in trials now for about a year. And as hopefully everyone knows, they continue to be monitored and tested. And so we will have an answer to that question. Based on what we know now, though, there is a general thinking that we will likely all need a booster at some point. The question is when, whether that's after 2 years. But I think that everyone in public health is leaning toward the likelihood of needing a booster. So we just don't know the answers to all of these questions, definitive answers to these questions, but we will. But it will take time. You know, remember, this is a brand new novel coronaviruses. We've had other viruses in the coronavirus family, but this particular virus, the SARS-CoV-2 virus, is novel. And so we are continually studying that, and papers will come out, scientific papers, not science on Google. You know, that's the other thing I think we should all, you know, keep in mind, is that we want to make sure that we are always following the science and the evidence. So we don't know as of yet, but we will have a definitive answer to that question.
Yep, I agree. Shirley, your thoughts?
Yeah, so we're actually working on a project to answer that question. And the only way to answer that question, right, is to track on a population level who's immunized, what vaccine are they immunized with, what is their antibody status over time, and did they have antibodies before they got immunized? Did they have antibodies after they got immunized? You know, so these are things that need to be tracked in conjunction with COVID testing of the population, and in conjunction with variant analysis of the population. And so with a robust COVID testing strategy, you can answer all of those questions, and your strategy will then dictate whether or not you need boosters, or who gets boosters, and which brand of vaccine of patients get the boosters.
Yeah, there's still a lot of unknowns for sure, right? And the level of individuals that got vaccinated at certain timeframes versus others, where they're coming from, and you know, there's still a lot of unknowns. And I like the approach, Dr. Harris, that you mentioned, the layered approach, thinking about this beyond just I'm vaccinated, so I'm good, and now I can go about my business, is really being more thoughtful and thinking into the future. Andrew, I want to get your perspectives on this, and then I want to shift over to our final question.
Yes, from the earliest days, we've been working with UCSF in San Francisco, and Dr. Bob Watcher and the team there have done really amazing work throughout this pandemic. And I recommend anyone here to watch their COVID Grand Rounds series. It's very insightful on the vaccines, and they're tracking and providing the latest data-based assessments of what's going on with the vaccines. I think doing my best to not speak for them, I think the main areas of concern at the moment are vaccines that are not mRNA. mRNA vaccines seem to be very durable and very strong within our populations. So if you have a population that doesn't have one of those for whatever reason, I think that's probably one of the first areas of concerns or first areas for boosting, possibly using kind of a combination of vaccines to kind of a more rounded perspective. But I'll let you watch their COVID grand rounds. I recommend it. The good news is a lot of these vaccines are just amazing. We've never seen vaccines this good before. And in the years to come, we'll really know how durable they are. But it's actually quite optimistic.
I used to joke with people and they would ask me which vaccine did I get, and I told them I got one of each, and I'll probably end up growing a tail or something. But no, I agree with you, Andrew, that the speed and the level at which these vaccines came to market is astounding. I want to kind of leave each of you with maybe a couple minutes to tell us, what does the future hold in your perspective? How is testing going to be incorporated? What does the world look like to you in a post-pandemic, world, whether it's testing or beyond? I would just love to hear your thoughts on all this after everything we've been through. I'll start with Andrew. You came off mute. I'll start with you, Andrew.
Sure. So I'm going to take an optimistic view that some of the practices we thought as normal, people at workplace with sniffles and our children coming home with a cold every other week, I'm hoping that those become less normal, meaning that we actually adopt some of these very basic techniques of mask wearing, testing, and make our lives a little bit more comfortable. As we go forward, if we have, another variant of the COVID virus or some other outbreak, we've been tracking over the past 10 years, a number of outbreaks that haven't quite grown to the level of in this country as COVID has, but we have to be ready for the next ones. So if we can all learn from this lesson and actually adopt easy, comfortable ways of bringing these best practices in our workplaces, getting comfortable with diagnostic testing, making it non-disruptive, we'll be in a great position for saving our senior population in the next bad flu year. Remember, before COVID, we had 2 of the worst flu seasons in a long time, and we lost a lot of people to that. And so those normals hopefully become less normals, and we can actually fight them. The other most optimistic thing I'm looking at is new vaccines for a large community, inoculation of the cold, the flu. It's really interesting what mRNA technology will develop over the next 5 to 10 years and bring to market. And Dr. Harris, I'd love to hear your perspective on that, actually.
Yeah, absolutely. And Shirley, you and I have had several conversations about some of the challenges you faced several years ago as you were trying to launch your company, and some of those regulatory hurdles that all of a sudden disappeared. I'd love for you to just touch on that quickly, but also give us your perspectives on where you see the future of testing and pandemic preparedness going.
Yeah, well, first of all, I see healthcare becoming much more local and globally accessible because of COVID. So COVID has opened up the door to not only from a regulatory standpoint, but from a consumer acceptance and a healthcare provider, most importantly, a healthcare provider acceptance standpoint. Providers now realize, hey, my patient wants to get their healthcare online, and I guess I'll do it, right? While simultaneously the laws are changing to make that possible. One thing that has happened with our company that we never intended to do as quickly as we did is, we became global literally in a matter of months. We're now all over the world with laboratory networks all over the world. Being able to connect and integrate and do these types of integrations in minutes rather than months, is really, really exciting. And the ramifications thereof, you can go anywhere in the world now and access healthcare, and have a catch net, a safety net, a catch net wherever you're going. That's really exciting to me. My whole life and career has been about creating these digital networks, digital healthcare networks. And so it's been very exciting and dream come true for us to be able to make that happen. So I think it's going to be more of the same. I think, more of that. I think also the long-term benefits are, we're more prepared for the next pandemic, right? Because the connections, these laboratory integrations and connections are in place, the reporting mechanisms to every single state and all the different governments, the reporting mechanisms are in place. That enables a response to happen much more quickly the next time. And I say the next time, a pandemic like this historically happens every 100 years, right? And often will last 10 years. If you look historically at the history of pandemics, we may be in this for another 8.5 years. And so, when you say after COVID, it's how do we live with COVID, and how do we get about our business and be as safe as possible? But I think technology and legislation has really been able to pivot to accept these changes.
Excellent. And Dr. Harris, I'll leave you with the final word.
Absolutely. And so let me just also say to the CEOs and other business leaders out there that I urge you to also think through as folks are returning to work. And we always say it's not just about returning to work, it's about staying at work. So, returning to work is a phase, but we want to make sure that folks stay at work. And clearly, testing is one of those factors that can help there, but also addressing mental health needs. And yes, I'm a psychiatrist, but I had to mention that, folks are anxious. This has been a very tumultuous time, and folks are anxious even about returning to work and being around coworkers. And so you need to think through some of those things, and how are folks spaced, and how is the filtration system? And so you might as well think about those things proactively as opposed to addressing them when they become crises. So I just wanted to raise that point. And yes, mRNA, I think, is going to be a game changer. Of course, it already has been with the vaccine, but I just saw a piece where folks are now looking at therapeutics and pills and medications using the mRNA technology. It may have been on 60 Minutes. I don't know, just recently, but I think we are going to see a lot more therapeutics with using the mRNA technology. And the last thing, and Cheryl said this, the COVID-19 pandemic has accelerated adoption of telehealth, digital health. I heard one person say, a little bit tongue in cheek, but looking at the silver lining is the COVID-19 pandemic has served as really a $100 million campaign to get folks used to and comfortable with telehealth and digital health. And so that is a silver lining here. And so people now have more comfort with technology, but they still have concerns. And so I believe that we will see increased adoption of innovation, digital point of care, because people want access to quality, rapid diagnostic testing. But why? Not in the service of just a quality, rapid diagnostic test, but so that you can have a result that's actionable, right? Confidence in the testing process and the results, then you have actionable information for you as an individual. Maybe you can get a treatment that prevents you from getting sicker, as we've seen with some of the antibody treatments. Certainly improved health outcomes from a population standpoint as far as outbreak management. And of course, that's lower cost for those of you who are self-insured and all of you are thinking about costs. Again, both productivity cost and cost to you directly. I mean, keeping people healthier and well certainly reduces your healthcare costs. And so we will get to, I'm optimistic about right tests, right person, right time, and right cost. It's certainly going to take a team effort, but I'm optimistic about the future.
Excellent. Thank you so much. Thank you to all of our panelists for your time and your great insights. To all the participants on the call, visit projectn95.org for additional information and resources. There's thought leadership, there's PPE, there's COVID tests, and it's a wealth of information there for you. So with that, I'd like to turn it over to Lindsay and thank all of you for joining us today.
Well, thank you all. If you have individual questions, you can see we have contact info listed out here. You can reach out directly to the Project N95 team. And thank you again to Project N95 for leading our panel today and our panel for sharing all your wonderful insights. We'll have additional resources discussed today when we email you the session recording. We really appreciate you joining us all today. Hope you found it valuable. We'll be posting this on our learning platform. We'll be doing another webinar with Project N95 in the fall. So it'll be interesting to see where we are then. That's it for today's webinar. Thanks for your time, and we look forward to seeing you on another ACCE Partner Solution webinar soon. Have a great afternoon.